everyone. Welcome to KSSP Podcast. I'm Spencer.
And I'm Katie. In today's series, we are going to be discussing some drug safety. So, there is an epidemic of drug abuse, along with a high rate of drug use in our country. Without proper education, this can lead to dangerous side effects, overdoses, or even death.
So we're first going to start off by saying that we don't encourage illicit drug use, but we understand that people use it for various reasons and want to provide information to help people stay safe.
So here are some tips for planning if you're going to use drugs. So tip number 1 is to make sure if you're going to use drugs that you are in a good headspace. If you're feeling uneasy, worried, upset, spiteful, etc., before you use, you're going to have a worse time and it may lead to you making unsafe choices. So tip number 2 is to always plan when you can. If you need a babysitter, set that up ahead of time, like somebody sober to watch you. Have all of the tools you need with you, including things like water, Narcan, maybe food, like whatever kind of tools you need. And try your best not to use drugs alone, especially drugs with a high overdose potential. And tip number 3, it's best to pick one drug, but whether or not you choose to use more than one drug, it is especially important to slowly pace your use. Don't use too high of a dose at once. If you need to increase your dose, do so after waiting for about 20 minutes or so. If you choose to combine drugs, use them in even smaller doses than you would using a single drug alone. And tip number 4, always test your product with an extremely small dose. If you have access to them, always use drug testing kits with your drugs you bought off the streets. Any drug bought off the streets can be laced, so this is especially important. The thing with drug testing kits I also want to mention, which is actually pretty awful, is that in some states at least, I don't know if it's all states or just some of them, but there are places where these drug testing kits are actually illegal. There are ways to get them, but unfortunately, a lot of people don't have access to drug testing kit due to these laws. So yes, if you don't have access, start testing your product using an extremely small dose. And then we've got tip number 5, know how to prevent, recognize, and help with overdoses. We will go over this a little bit later in the video, or in the next video rather. When using opiates, always carry naloxone, aka Narcan. And then tip number 6, final tip here, is to spread awareness to keep other people safe. If you're using with others, make sure you're giving them good safety information so that everybody can have a safe, fun time. And next, we are going to look at the National Harm Reduction Coalition. This is Safer Drug Use 101. Some safer consumption tips include someone smoking. Use a pipe, stem, or a bong. Make sure everybody has their own pipe or mouthpiece if you can. And if you're smoking crack, use a filter. So for snorting, you want to crush powder as fine as possible and make sure everybody has their own straw. Alternate nostrils between hits. If you're swallowing drugs, pills or powder, it says crush in thin paper or a drink. But with some pills, you can swallow them whole. But if you are mixing it into a drink, mix your drink so you know how strong it is. And it can take up to an hour to kick in, so wait a while before consuming more. And booty bumping, or boofing. So using a turkey baster or a syringe without a needle. Use a turkey baster or a syringe without a needle. You can just pop the needle off of the syringe. And avoid sharing equipment and get vaccinated for hepatitis A. And finally, with injecting, use your sterile syringes and gear. If you need to reuse syringes, wash them with cold water, bleach, and then water again. Also with injecting, This is just something I'm adding in here. But with injecting, do not use cotton balls to filter your drugs because you're going to risk cotton fever, which is a benign self-limited febrile syndrome characterized by fevers, leukocytosis, myalgitis, I don't know what that is, nausea and vomiting, occurring in injection drug users who filter their drug suspensions, which is the mixes of the drugs in the water, through cotton balls. So you also want to understand risk, set, and setting. So the risk is the risk itself that you're discussing. Your set is your mindset going into the experience. And your setting is your physical and social environment. You definitely want to make sure you're in a safe environment.
Yeah. And then also, harmreduction.org has tips for injecting and preventing transmittable diseases from drug use. So make sure to check out their website for more tips if you are injecting your drugs.
So we're going to start off with opioid overdoses, which I think are the most common. Don't quote me on that, but I'm pretty sure they are. So let's go over what is naloxone. Well, naloxone, also called Narcan, is a medicine made to quickly reverse opioid overdoses. It is an opioid antagonist. This means that it attaches to the opioid receptors and reverses and blocks the effects of other opioids. But if there are no opioids in your system, it will probably have a couple of side effects, but ultimately have really no effect on you. So there are a couple different kinds of naloxone. There's injectable. The proper dose is drawn up from a vial. Usually it is injected with a needle into the muscle, although it might also be injected into a vein or under the skin. Nasal spray. This kind of naloxone requires no assembly and is sprayed into one nostril as the person overdosing lays on their back. So studies show that injectable Narcan is more effective than nasal spray, although any Narcan is better than none at all for an overdose. The half-life of naloxone is roughly 30 to 90 minutes. This is less than typical opiates, so there may be some overdose effects after the naloxone wears off. This is why getting help from medical professionals for overdoses is essential. People who are given naloxone should be observed constantly until emergency care arrives. After the last dose of naloxone is given, they should be monitored for 2 hours. Make sure breathing does not slow or stop. So, here's a question that a lot of people don't know the answer to, or at least the correct answer. Can fentanyl be absorbed through the skin? This is a common misconception that fentanyl can be absorbed through the skin, but it is not true for casual exposure. You can't overdose on fentanyl by touching an object with powder fentanyl on it. The one case in which fentanyl can be absorbed through the skin is with a fentanyl skin patch, typically prescribed by a doctor, and it takes 2 hours of exposure for those patches to dissolve into the skin. This is important to keep in mind as opioid overdoses are a serious situation in which we need to be aware of their root causes. So we're going to go over this article. It's from SAMHSA. What do we need to know about opioid overdoses? So let's see. So an opioid overdose can occur for a variety of reasons, including when a person overdoses on an illicit opioid drug such as heroin or morphine, when a person overdoses on a medication used in medication-assisted treatment, many of which are controlled substances that have the potential for misuse. This can occur when someone accidentally takes an extra dose, deliberately misuses a prescription opioid, or mixes opioids with other medications, alcohol, or over-the-counter medications. An overdose can be fatal when mixing an opioid and anxiety treatment medications, including derivatives of benzodiazepine such as Xanax and Valium. When a person misuses an opioid-based pain medication, using not as prescribed by their physician or one prescribed for someone else. Children are particularly vulnerable to accidental overdoses if they take medication not intended for them. So an opioid overdose can occur even with prescription opioid pain relievers and medications used in MAT, which is medication-assisted treatment, such as methadone and buprenorphine. In addition, individuals using naltrexone for MAT have a reduced tolerance to opioids, and therefore using the same or even lower doses of opioids used in the past can cause life-threatening consequences. Also, follow the instructions you receive with your medication. Ask your practitioner or pharmacist if you have questions or are unsure of how to take your medication. So here's how you can help avoid opioid overdose. Take medicine as prescribed by your practitioner. Do not take more medication or take it more often than instructed. Never mix pain medicines with alcohol, sleeping pills, or illicit substances. Never take anyone else's medication. Prevent children and pets from accidental ingestion by storing your medication out of reach. And dispose of unused medications safely. Talk to your MAT practitioner for guidance or for more information on the safe disposal of unused medication. You can visit this FDA site or the DEA's webpage. All right, so now we're going to talk about recognizing opioid overdoses. Call 911 immediately if a person exhibits any of the following symptoms. Their face is extremely pale and or it feels clammy to the touch. Their body goes limp. Fingernails or lips have a purple or blue color. They start vomiting or making gurgling noises. They cannot be awakened or are unable to speak. Their breathing or heartbeat slows or stops. So treating an opioid overdose. If the person has stopped, so first you got to call 911. Even if you're planning to leave the scene, you should still call 911. Like, you don't have to be there when they show up. You can do it even as you're walking away. You can still call 911, although you really should stay there and make sure the person doesn't die. But, if you're that worried about the police, at least call 911 before you leave the person so that somebody can come help them. If the person has stopped breathing or if breathing is very weak, begin CPR, best performed by someone who has training. And although if you don't have I guess I don't know about if you don't have training. If available, treat the person with naloxone or Narcan to reverse opioid overdose.
So, next we're going to move on to alcohol poisoning. So, according to Mayo Clinic, symptoms of alcohol poisoning include seizures, slow breathing, less than 8 breaths a minute, irregular breathing, a gap of more than 10 seconds between breaths, confusion, vomiting, low body temperature, passing out, unconsciousness, and unable to be awakened, and or blue tinged skin or pale skin. And what should we do if we notice someone experiencing alcohol poisoning? Well, generally, as always, we should call 911 and be ready to provide info to operators and emergency staff. Don't leave the person alone and keep them on their side. Do not let them lay on their back, as this could cause them to choke on their vomit.
All right. And then next, we're going to talk about overramping, aka stimulant overdose. And this is according to harmreduction.com. So physical symptoms include nausea and vomiting, chest pain or tightening in the chest, falling asleep or passing out but still breathing, fast heart rate, racing pulse, high temperature, sweating profusely, often with chills, irregular breathing or shortness of breath, convulsions, limb jerking or rigidity, stroke, feeling paralyzed while awake, severe headache, hypertension or elevated blood pressure, insomnia or decreased need for sleep, teeth grinding, and tremors. And the psychological symptoms include panic, extreme anxiety, hallucinations, extreme paranoia, increased aggressiveness, restlessness or irritability, extreme agitation, enhanced sensory awareness, hypervigilance, or being super aware of your environment, sounds, people, etc., and suspiciousness. So, what do you do when someone is overramping? First, you want to cool them down with ice, water mist, fans, a cold wet towel, anything to cool the body down. If their body is not cooling down, they may be experiencing hyperthermia, which is when the body cannot cool itself down. If this is the case, it is a medical emergency, and calling 911 is the best course of action. This can also lead to strokes, so if you're interested in the science of stroke, we do have a video going over this. And it may also lead to seizures. So call 911 if the seizure lasts more than 5 minutes, the person has one seizure right after the other, the person does not regain consciousness, the person appears to be injured, the person's color or condition remains poor, the person does not start breathing with 1 minute after the seizure has stopped, start CPR, and if this is a first-time seizure.
So, when you're calling 911, what typically will the operators want to know? So, they will want to know what drugs did the person take, and can you locate the drug's container? How much of the drug did the person take? When did the person take the drug? Was the drug taken with alcohol or any other medications or chemicals? What is the age of the person? What symptoms is the person experiencing? Is the person conscious? And is the person breathing?
So determining a drug overdose may be a symptom-based process. However, the drug may do extensive damage to the body before significant symptoms develop. So, different drugs have varying effects on the body's acid/base balance and certain blood elements like potassium and calcium. Blood tests may be used by medical professionals to detect changes in the chemistry of the body that may help to determine what drugs the patient took. Doctors may also test for various drugs in the patient's system. Once doctors identify which drugs caused the overdose, blood tests monitor how fast the drug clears out of the patient's system. Urine analysis can also be administered to test for certain drugs and detect changes in chemistry of the body. Blood and urine tests may also show damage to the liver or kidneys due to the overdose. So, we're going to look at some numbers here. We've shown these charts before, but we're going to go over them once again. These are the ratios of effective doses to fatal doses and dependency levels of each drug. So first, let's go to our images here. The ratio of fatal dose to effective dose. So what this means is the fatal dose is obviously the fatal dose, the dose that causes overdose. The effective dose is the dose it takes to get you inebriated. So what this ratio means is that, for example, with marijuana, let's look at that one. So it says over 1,000. So this means that if one dose gets you inebriated, it would take over 1,000 doses to cause an overdose. That would be about 1,000 for LSD and psilocybin, or magic mushrooms as they're known as well. And then nitrous oxide, one effective dose is compared to 150 as a fatal dose. Kava is 75. Dimethyltryptamine is 1 to 50. Ketamine is 1 to 38. Rohypnol is 1 to 30. Mescaline is 1 to 24. Codeine is 1 to 20. MDMA is 1 to 16. Cocaine is 1 to 15. Alcohol and dextromethorphan are 10. And I believe methamphetamine is on that level as well. And then GHB is 1 to 8. Isobutyl nitrate is 1 to 8, as is datura. And then nutmeg is 1 to 7. And heroin intravenous is 1 to 5. So then they label here less lethal than alcohol and more lethal than alcohol. Although for some of these, I'd be curious about other methods of, what's the term? Like other routes of administration. I'd be curious to see for a couple of these. And then the next chart we're going to go over here is the safety ratio and dependence of potential drugs. So let's see, heroin, the effective dose, if the effective dose is 8 milligrams, the lethal dose is 50, and the safety ratio is 6. Dependence potential is very high. For morphine, effective dose is about 20 milligrams, and lethal is 300. Safety ratio is 15, and dependence potential is high. With barbiturates, such as pentobarbital, 250 micrograms milligrams is an effective dose, and then 5 grams would be the lethal dose. So the safety ratio is 20, and dependence potential is moderate to high. Benzodiazepines, such as rohypnol, the effective dose would be 1 milligram, lethal dose would be 30, the safety ratio is 30, and dependence potential is moderate. With alcohol, ethanol, the effective dose is 30 milligrams, then the lethal dose would be 300, and the safety ratio is 10. So dependence potential is moderate. Stimulants, caffeine, the effective dose is 100 milligrams, the lethal dose is 10 grams, and the safety ratio is 100. So that dependence potential is moderate to low. Cocaine, effective dose would be 80 milligrams, lethal dose would be 1.2 grams then. So the safety ratio is 15, and dependence potential is moderate to high. Ephedra, 25 milligrams effective, lethal is 3.5 grams, safety ratio is 140, and dependence potential is moderate. MDMA, effective dose is 125 milligrams, lethal dose is 2 grams, safety ratio is 16, dependence potential is moderate to low. Nicotine, effective dose is 1 milligram, then the lethal dose is 50 milligrams, so the safety ratio is 50, and dependence potential is high. Ketamine, the effective dose is 70 milligrams, lethal dose is 2.7 grams, and safety ratio is 38. Dependence potential is low. Nitrous oxide, effective dose is 3.5 liters, lethal dose is 525 liters, safety ratio is 150, and dependence potential is moderate to low. Then LSD, 100 micrograms is the effective dose, 100 milligrams is the lethal dose. So the safety ratio is 1,000, and that's a very low dependence potential. And then mescaline, effective dose is 350 milligrams, then the lethal dose would be 8.4 grams, and the safety ratio is 24. Dependence potential is very low. Psilocybin, effective dose 6 milligrams, lethal dose 6 grams, a safety ratio of 1,000, and the dependence potential is very low. And finally, we have cannabis, so marijuana. 15 milligrams would be the effective dose, then more than 15 grams would be the lethal dose, and the safety ratio is 1,000, and dependence potential is moderate to low. Now, of course, this is going to depend on a couple things. So your tolerance, for one. If your tolerance is higher, you're going to have a higher effective dose and a higher lethal dose. And the other thing is people also will just vary from person to person in general with their tolerance as well. So some people will naturally have a higher or lower tolerance than others. These are just, I assume these are averages here. I don't know how else you would determine the dose for each individual person. So, yeah. Those are the safety ratios and dependence of potential drugs. So, okay, to me, drug safety is especially important because we must acknowledge that no matter what we try to do to stop it, people will always find ways to use drugs, whether they're legal or not. The best thing we can do to ensure that drug users are as safe as possible in order to prevent medical issues and even death. It's important to note that some drugs are safer than others. Regardless, it's important to always start slow and test your drugs every time you get a new batch, ideally with a drug kit, but whether or not you have access to one, always take a small first dose and see how you react if you are planning on using drugs.
Yes, I would just agree with all that because I think, like you mentioned, I think the reality is that people are going to use, so it's better to provide helpful, safe information so that they have that information, you know?
Yes, exactly. All right. Well, thank you for joining us on our drug safety series. And we would just like to thank everyone who's been watching, liking, and sharing. And we just want you to know that we really appreciate you.
And we are excited to have you guys along on this journey with us as we see where, I guess, KSSP podcast goes. So it's an exciting journey, and we're excited to have you guys along with us. And as always, if you have topic ideas that you want to hear us talk about in future episodes, just feel free to leave a comment below.
You can reach out to us on Facebook, YouTube, Instagram, Twitter, TikTok. We also occasionally do some Twitch live streams, so follow us there if you want to be notified when we do.
And don't forget to give this video a like and follow or subscribe to our other social media accounts. And if you want to be notified about when our future content comes out, don't forget to turn on those notifications either. Otherwise, we will see everyone next time.